physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
They're one
therapist.
of the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right. Well anticipated here. We're going to talk about how to fix your knee from clicking, popping, or creaking, making joint noise.
Yeah, all those things that are pleasant to hear, but hopefully they're not
pleasant to hear.
Well, if they're not painful, you know,
Right.
as a therapist, I'm thinking it's okay.
Yeah, again, we just did a video on possible causes of knee pain. You may want to watch that video. It's part of a series of videos on knee pain.
wow.
So if you go to bobbrad.com, go to the program section, check out knee pain, you'll find that video.
That's right, and there's a whole list of videos to pick out the right one. These videos are completely free. We do not ask for your email, and there's a PDF printout that has a review of the whole video as well as the exercises that go along with it.
You can send us some good vibes, though.
Oh, yeah.
Yeah,
Yes,
always like good
do.
vibes.
Yeah, I felt some last night. I was laying in bed. Someone's watching
All
a
right.
program.
All right, let's get to work, Brad.
Okay.
All right. So generally, if clicking, popping, or grinding is not accompanied by pain, you don't need to worry about it.
Right.
But if you're having any of those things, pain, swelling, locking, weakness, you may want to see a clinician, but you may also find out if one of these things is the problem and try treating it.
Right. If it's not very painful, but you notice there's some pain, you know, maybe you could try these before you go in to see
Sure,
a doctor.
exactly.
And that may resolve itself.
That was something we would do. I mean,
Yeah, that's what I would
say.
do.
All right. First one, cavitation. That's when basically a release of gas
Nitrogen
bubbles.
gas from
Yeah.
a liquid to a gas, and it goes pop, and that's why a lot of our joints crack your knuckles. That's why it happens.
And you aren't going to have pain with that.
Typically, no.
So the treatment for this is you don't have to do any treatment.
Yeah,
There's no pain. What are you worried about? Let it pop.
that's right. Just you can aggravate some people with it, you know.
Yeah,
and
that's right.
say, oh, don't do that.
All right, ligaments and tendons, sometimes they can catch as they slide over a bony hump.
Yep.
We're going to talk about the IT band, this the long band that runs from your hip down to your knee.
Sure.
And it can slide over the knee with biking or running or
Yep.
some type of repetitive activity. Now, you can't really stretch this band.
Yeah, it's real wide and it's very tough.
Yeah, it's
leg,
thick.
leg or tendon.
But what you can do is sometimes this band gets adhesed down to the tissues below
Yep.
it. And so what you can do is massage this band. Very difficult to do with your hands. You can go ahead and try.
Yeah, you can do it. You just get tired.
Tired,
pretty
right.
quick.
But a better option would be to actually take a massage gun or a handheld massager. And
Well-
Brad's going to show that as an example here.
Yeah, you certainly wouldn't want to do it with a head like this that's very hard. A round head, slightly soft, works the best in my opinion.
And most of those guns come with different attachments.
Yep. Our guns all come with 5 heads, definitely with these. You know, you may go in straight in on it like this, but probably better off to go in at an angle, and you'll get some of that cross fiber activity going on.
Sure.
Now, I probably wouldn't be like this. I would lay down on the floor. I don't know if we need to do that, but
Sure.
and work that. Let me try here like this. There we go. There. And now I can work that. You got to be careful over the bony area.
Right.
You're definitely not going to go in over the bone. You have to go sideways over there. But you can, and this actually feels good right now on there. It feels like I'm moving the skin, the tissues underneath the skin, and
I'll
up
go
here.
all the way up the band.
Yep,
Yeah.
absolutely. And you could even get up into the hip muscle.
Tensor fasciolata.
Yeah, that's
Yeah.
the muscle belly of that tendon.
And the glute, I think, attaches into it.
And I'm telling you, this just feels good.
Right.
But it's still relaxing those muscles, which is going to take tension off down
And
distal.
stretching those muscles a little
Yep.
bit. So, absolutely. Okay, how about if you have a cartilage tear? A cartilage tear can cause sound in your knee. Now, you think, well, what can I do about a tear? Well, one thing you can do is after you have a knee injury, knee pain, you quite often, this muscle, the quadricep, gets weak. So I should say these 4 muscles get weak. And a very simple exercise you can do without putting increased stress on the knee is just to do isometric quad strengthening. So all you're going to do is you're going to put your leg up on a pillow like this.
Yep.
And you're going to actually, I'm going to leave this leg down so you can see. All you do, you can do this in bed, and you're going to push down like this
Yep.
and hold it for 10 seconds
Yep.
and then relax. And you do that times 10 times.
Right. So typically,
Squeezing this.
yeah, getting those quad strength moving.
Yep.
You're not putting weight through the joint. That's why we have
Right.
it up like this. So that
There's not that much movement.
right.
So it's very simple. Do 3 sets of 10 3 times a week. And it'll strengthen that quad. And often that will take some of the stress off the knee, which will hopefully decrease some of the pain of the knee.
Sure.
All right. You can also, you can do some continuous movement to the knee. We hope maybe that'll smooth out the cartilage a little bit. We're talking about non-weight bearing. That's one way to do it.
These are called, we call them long arc quads or kicks, whatever you like. But this does work to quad. Do them slow, do them with purpose. If you have something on the floor, we use a new knee glide.
That's a fit glide.
Oh, yeah. It's a double knee glide. Yeah,
Yeah.
it is a fit glide. It works both of these because you might as well work both of them.
Right. Keep things equal.
Yeah, and just keep it going like that. I do like this option because it not necessary, but it's nice to
Well,
get
it's
it
got
at
the
an
handle,
angle.
so you're working hamstrings a little bit more now. If you
Yeah.
flip around, it does more quadricep.
Yeah, so you get 3 different exercises that emphasize different muscle groups and the joint at a little bit different angle, which is
Brad and I are really
nice.
proud of this. For one reason, it's so lightweight.
It is.
Anybody can carry it.
Yeah. This is the finger.
A child of 4 can carry it.
A child of 4?
Yeah.
4 what? Oh, 4
4
children?
years. 4
Oh,
years.
4 years old. Yeah, yeah. Absolutely.
All right. Eventually, too, Brad, I've seen this in studies that if you do some weight-bearing activities with this, like Tai Chi
Sure.
or just plain old walking is good for it, for the cartilage.
Oh.
being torn.
Yeah, as long as it's not painful, it's not locking up, you want movement with it, the weight bearing can be helpful as long as it is pain-free.
All right. Another situation is if you have osteoarthritis or arthritis in your knee joint, that smooth cartilage that covers into the bones has become rusty, as you
Yeah, well, it's rough.
Flaky.
Yep, and
So you would actually do the same things I just showed you. You could do the isometric quad strengthening.
right,
You could do the knees. Yep.
the kick,
Trying to get a little more fluid moving in there.
right.
And you could actually use fit glide, and you could try walking in Tai Chi. Those all are the same.
But no yoga.
Well, no, you can do yoga.
Oh, okay. I
Yeah.
just was curious.
All right. How about if it's caused by, well, we can call this kneecap syndrome. So it's the patellofemoral pain syndrome.
Yeah.
So you have the kneecap here. It's not lined up correctly, possibly in the groove. So one thing you want to do is maybe stretch it, which Brad is doing right here. Now, don't do this if you have very loose joints or if you have rheumatoid arthritis. I don't want you to push that kneecap out of there. But for most people, you'll find out, God, it's really tight.
Yeah.
And so it needs to be stretched. Now, you have a very loose kneecap, Brad.
Well, sometimes I've had people where you just mobilize the patella or the kneecap, get it moving and this way and this way, and that can help loosen it up and make it feel better. It's very simple. It should be pain-free while you do it. It should feel good, actually. Otherwise,
Yeah,
you shouldn't.
it's
do
really easy to try. And like if you find a direction that really is tight, maybe work on that direction
Yeah.
only.
The key thing about this is you have to learn to completely relax your quadriceps. Otherwise, if I tighten a little bit, it doesn't move at all.
Right.
It's stuck
And
there.
you don't want it to, a lot of people say, oh, that looks icky.
Well, when I was in PT school, I had no idea that you could do
Yeah,
that
do
to
that,
PT.
exactly.
It's like, oh my goodness, let me try it on my knee. And it's like, wow, it works. Anyways,
Yeah. So in addition to that, you can actually strengthen the hip external rotators. I'm not going to get into the mechanism why that is, but that all you got to do is clamshells. You lie on your side like this, and you actually put your legs apart. And
Yeah.
you lift up like this.
this is nice because when you go to bed, you can, lay
Yeah.
on your side, do, 10 to 20 of these, whatever you need. But do them slow like Bob's doing them, good control.
Yeah.
Feet stay together. It acts like you hinge there. And it gets those hip muscles that are responsible for making that hip and knee.
If you do like 3 sets of 10, you'll start to feel it.
Yeah.
I mean,
Especially if you haven't done it before.
just
Oh,
kick you?
be
No.
careful, Bob.
All right, the last one is sometimes scar tissue. If it's getting around the knee, you injured the knee in the past, and there's some scar tissue that's catching on other surfaces. Now, you maybe can't do anything about it unless you know where the painful area or where the scar tissue
Yeah.
is. So, for example, let's say right above the knee, you could massage that area, a
Well,
crossfire massage.
Like if you know where the scar tissue is because you had surgery, like the incision, like
Yeah.
then that makes it a lot easier. Otherwise,
Right.
if you don't, you have to
Yeah, you got to
figure
kind
it
of push
out.
around. It's usually going to be the tender spot, and you can actually do cross fiber massage. So what you do is, let's say you find the tender spot and you start rubbing across it. Now that pain should start to reduce within 30 seconds or so, or
right.
at least plateau.
Yeah.
If it keeps getting worse and worse and worse, no, you can't do this.
Yeah. After 30 seconds, it still hurts or getting red. You just it stopped.
Now, if you want to make it easier on yourself too, you can use a massage gun. It'll actually help work the area a lot easier.
Save your thumbs and your
Right.
fingers. If I was doing that same thing here, I wouldn't go straight in too close to the bone. I could do it up here in the muscle, but then I'm going to go sideways here. And if I worked up in the muscle, then maybe I can get in a little deeper there. And that's, that's kind of the art of using a massage gun when you learn different angles and it's just not a straightforward, beat the heck out of the muscle. You got to work it properly.
So, what I'm saying here is if you don't know what's causing the clicking, you might have to see a therapist to have them diagnose it.
Sure.
And then you can work on trying to get rid of it.
Yeah.
But generally, you're not going to see a therapist unless it's hurting.
Right.
Otherwise, you can let it, make sound all you want.
Yeah, but doing some of these exercises, the range of motion, the walking, things like that.
That's good for you no matter
right.
what.
Unless
Right.
you walk a mile and it makes it really sore, well then.
Yeah, and massage is good for it no
Yep.
matter what it is. So
Yeah.
none of these are harmful to
Right.
a large extent. Again, be careful with the kneecap one.
Yeah.
I don't want you to push it out of place if you're a really loose jointed person.
Yeah, and some people, especially the guys out there, think a little pressure is good. We might as well push it.
Whoops.
Push it all the way around, half the way around the knee.
Most people, it's not very easy at all to push it out of the way.
Right, yeah.
Out of joint.
So the big thing is be careful, use good judgment.